Is your current immunization messaging reaching everyone it should? In this video, we will discuss who to reach with information about immunization services, how to target your messaging, and what strategies you could use to reach different audiences. First, who should you reach with information about immunization? Immunization programs often only reach mothers with information about immunization. Yet in some communities, women do not have the decision-making authority or resources required to bring their children for vaccination. Reaching all caregivers with information about immunization allows both mothers and fathers to learn about immunization services. By trying to reach all caregivers, you can also help address the unequal roles, access to resources, and decision-making authority of mothers and fathers within a community. Why is it so important? When both mothers and fathers are involved in caregiving and decisions about immunization, it can actually increase the likelihood that children will be brought for vaccination services. Beyond mothers and fathers, others may influence whether a child is brought for vaccination. Decisions about healthcare are often made within the extended family, and those decisions may be influenced by other people in the community, such as traditional, cultural, and religious leaders. So, consider the roles played by household members other than the mother and father, and engage those household decision-makers with information about immunization. By doing so, you can help remove potential barriers to immunization and improve child health outcomes. How can you identify these influencers in the community? Start by speaking with women's groups in the community, as well as community health workers and volunteers who live in the community, to learn more. Ask questions to learn more about who influences decision-making. For example, you might ask, who makes decisions in the family about children's health? What are the beliefs held by the community that prevent caregivers from having their children vaccinated? Who influences those beliefs? Hold a focus group discussion to speak with these community members, and be sure to include both women and men in the discussion. Once you have identified who you want to reach with messages about immunization, how can you target the right message for the right audience? First, target your messaging to address the specific concerns of the audience. For example, if fathers in your community are concerned with the finances of their families, you might offer messages about how vaccination helps prevent illness, which can be costly, especially if a family must travel to a medical center to receive treatment. You might also incorporate the idea that within a household, the father plays an equal role in parenting, childcare, and other domestic responsibilities. Or reinforce the idea of equal decision-making between mothers and fathers. Keep the needs of your audience in mind. For example, if you're trying to reach caregivers or other household decision-makers who may not be able to read, use posters that communicate with pictures instead of words. Just be careful to avoid harmful stereotypes in your immunization messaging. What strategies could you use to reach caregivers and influencers with messages about immunization? First, think about how you currently share information about immunization. Are you reaching women and men equally? When targeting caregivers with information about immunization, always try to reach both. For example, if you currently have programs that focus on mothers, complement your work by adding programs that involve fathers or other household decision-makers like mothers-in-law. In one country, health workers held sessions just for men and use interactive games to get them interested in immunization. Consider facilitating regular sessions with women and men. Joint sessions could help women and men participate in parenting more equally, especially when it comes to making decisions about healthcare. Use outreach services or other channels to speak with elderly women directly about the importance of child and adolescent vaccination. In one country, elderly women were engaged as volunteers and provided with training and information on basic health, polio, and routine immunization status of their communities. Finally, engage with other influences in the community, such as traditional, cultural, and religious leaders. If they understand the importance of immunization, they may serve as immunization advocates and share messages with their networks of community members. Engaging all caregivers and influencers with information about immunization services will help you ensure all children in your community receive the vaccination services they need.